management support, infection prevention and control, epidemiological surveillance, risk communication and community engagement, and also in case management. However, the nature of the support will indeed evolve based on the evolution of the epidemic and based on the evolution of the needs in the provinces and here at the national level. We must anticipate that this virus is likely to stay with us for some time. We therefore need to learn to live safely with COVID-19 by minimizing risks and reacting quickly and comprehensively to flare-ups. I'm very pleased that we arrive here at the moment that we're starting to see a reduction in the number of daily cases in South Africa. However, we think that there is still room to accelerate the pace that is going, and that is why we thought there's still room for WHO to come here and to provide this support. The strategy moving ahead should be aimed at protecting those who are most at risk of severe disease, including older people and those with comorbidities. We need to have a sharp focus on protecting vulnerable communities, averting super spreading events, and minimizing the risks of reimportation. I've followed very closely all the debates and discussions that have taken place here in South Africa, and just have to say to you, Minister, that what you are going through is happening worldwide. Those debates about balancing, opening up, about looking after health, about making sure that those who are most vulnerable are protected are indeed going on worldwide. Longer-term gains rely on sustained public participation in effectively adhering to preventive measures coupled with strong public health capacities and resilient health systems. While we tackle the pandemic, we must not lose focus on other pressing health needs. We must minimize healthcare disruptions caused by COVID-19 and ensure the continuity of essential health services. I wish to conclude with a quote from our great leader, the Honorable Nelson Mandela, who said, "It always seems impossible until it is done." We stand united in our fight against the COVID-19 virus, and I'm quite certain that we will win this fight. I thank you very much for your attention. So it's my great pleasure now to It's my pleasure now to invite the Director General, Dr. Tedros, to speak to us from Geneva. Tedros, you have the floor. There he is.
Let's unmute him. Can you unmute him? Yeah, that's fine. You can unmute him. Let's unmute him quickly.
Do I have to tell him he was muted?
Yes, we'll unmute him.
You will tell him?
Yeah.
Okay.
No, he's not muted.
He's not muted.
Check your sound card there.
We apologize for the technical interruption, and we're trying to get Dr. Tedros back. Are you able to take care of the... Okay.
Coming from his end. Is it the line or?
No, it's the sound. Can you proceed? Okay. Thank you, Dr. Tedros. It seems we've been able to get our sound back. Please proceed.
So, from the start?
Thank you. Yes, please, Dr. Tedros. Thank you. Please start again. Yes, please. Thank you.
You didn't hear anything?
No, Dr. Tedros. Don't pretend.
Oh, sorry. Okay.
Thank you. Thank you so much. And apologies.
Taking my time, yeah. All present, Dr. Zweli, Mkhize, the Minister of Health, Your Excellency, Dr. Joe Faala, Deputy Minister of Health, and my two sisters there, Regional Director of Health, the Regional Director for Africa, my Regional Director, Dr. Zweli and Resident Coordinator of the UN in South Africa, Ms. Nardos Bekele, and Director General of Health, Dr. Sandile Buthelezi, Excellencies, dear colleagues and friends. I would like to express my gratitude to the government of South Africa for hosting this ceremony welcoming the WHO experts that will be supporting the Ministry of Health and other agencies in their response to COVID-19. WHO stands with the government of South Africa in its effort to bring the spread of COVID-19 under control. Our long-standing cooperation with South Africa on a range of issues, from HIV to maternal health to universal health coverage, gives us a firm grounding to work together on this latest challenge. I want to especially recognize the role that President Ramaphosa, who is also the chair of the African Union, has played in COVID-19 preparedness and response in the African region. I would also like to commend him and South Africa for its efforts and participation with the Access for COVID-19 Tools Accelerator and in solidarity trials, which will facilitate the development, production, and equitable access of critical vaccines, diagnostics, and therapeutics. As indicated, sorry? Has it dropped again or?
I think now he muted himself.
You can hear me.
Hello? No, can you hear me?
Yes.
Yes, Dr. Tedros.
Okay. So, as indicated by DG Buthelezi and also RD Moeti, South Africa is one of the hardest hit in Africa, and the government's prompt and robust response to the pandemic, of course, gives us reason for optimism, as cases have recently been decreasing. And anything can be turned around, but now is not the time to let our guard down. And as public and social distancing measures are lifted, it's critical that we remain vigilant. Even as we're dealing with the immediate response, we must focus our efforts on mitigating the long-term effects of the pandemic, including major disruptions to essential health services, schooling, nutrition, and livelihoods. In response to the request for support from the government, WHO has established a 3-level COVID-19 policy and technical support, as already been described by my regional director, Dr. Moeti. So I don't want to go into details on that. Dr. Moeti and also Dr. Mike Health and its partners have shown great commitment and diligence in their efforts to curb the spread of COVID-19, and we hope that these experts can supplement and expand your efforts. On behalf of WHO, I'd like to convey my best wishes for a successful mission to the Ministry of Health, the visiting and virtually deployed experts, and to all our partners. By working together in solidarity, we can bring this pandemic under control. Thank you again for this opportunity, and very honored to join you today. Thank you.
Thank you very much to such a nice, crisp and eloquent speech from the WHO DG, Dr. Tedros, and we really appreciate that he's made time from his very busy schedule. And thank you very much to the RD, Dr. Moeti, also for the good remarks. And I guess probably the actual introductions will allow, after the minister, that Dr. Owen will introduce the team that is here at a later stage. But for now, I think it's my honor and privilege to invite the Minister of Health, a well-known, tried and tested leader, who's actually been in the field for years, and under his stewardship, I think we are able to walk with our heads high. Dr. Mkhize, thank you.
Thank you very much, Dr. Buthelezi, our Program Director and the Director General of the Department of Health in South Africa, my colleague, the Honorable Deputy Minister, Dr. Joe Pahla, the WHO Director General, my brother, Dr. Tedros Adhanom Ghebreyesus, the WHO Director, Regional Director for Africa, Dr. Matsidiso Moeti. Welcome, my sister. Our WHO country representative, Dr. Owen Kalua, and at this point, we count you as a South African delegation. Director General, the Deputy Directors General present, senior officials from the WHO, and senior officials from the Department of Health, members of the media, and our special greetings to the WHO Surge Team and fellow South Africans. It is my humble honor today to officially welcome the World Health Organization Surge Team, and I do so on behalf of the government of South Africa, led by His Excellency President Ramaphosa, who had very much wished to do this honor personally, but due to pressure of work, we have understood that he is unable to be here with us, but he continues to lead this effort and was quite supportive and excited when this move was made to get the support from the WHO, as has been the situation when we had to receive assistance from the Cuban government and other assistance and support, which was led by President Ramaphosa personally, particularly as he approached the various leaders of governments, such as in China, in America, and the African Union as a leader of the African Union as chairperson. So we want to thank President Ramaphosa for his leadership, his outstanding leadership in this fight, because whatever successes we can record as South Africans is actually as a result of the leadership, the guidance that President and the members of Council and those of the Coronavirus Command Council and the various levels of leadership in the country have provided. If anything, this has been one crisis that has allowed us to work together in a unified manner as government, different spheres of government, and civil society, with business, labor, civil society, and all different sectors of society to fight this common enemy, an invisible enemy of COVID-19. South Africa is truly blessed to have this caliber of expertise as represented by this surge team in its midst as we continue to be at war against the coronavirus. Although South Africa shares a long and rich kinship with WHO, the significance of this bond has never been more highlighted than during this cataclysmic period of our era. Indeed, we have a proud track record of partnership with WHO, and looking back over a decade or so, one can recall some instances where WHO heeded to our call and supported us in staging responses that mitigated devastating effects of public health emergencies. Between the year 2000 and 2002, we had a major cholera outbreak with cases exceeding 100,000 in KwaZulu-Natal alone. It was with the help of WHO that an effective response was staged and the case fatality rate was kept at less than 0.5%. Give me a sense of deja vu, because when that happened, we were again right in the eye of the storm in that province where we had to deal with various communities, particularly religious gatherings and traditional ceremonies, wherein this whole message of prevention and containment had to be spread to the communities outside the walls of the clinics and hospitals. The water and sanitation and hygiene wash lessons learned and systems developed became evidence in 2003, 2008, and 2018. In all instances, the deployment of WHO expertise, South Africa managed to stop the epidemics with a case fatality rate around 0.5%. Not so long ago, during the listeriosis outbreak, 2017-18, WHO provided support to the Multi-Sectoral Incident Management Team, IMT, and co-developed an updated listeriosis emergency response plan. In the same year, the WHO sent a delegation of 16 delegates to make an intervention through the WHO Listeriosis Regional Technical Meeting, which took place in Johannesburg from the 19th to the 21st of April in 2018. The FIFA World Cup 2010 coincided with the global H1N1 outbreak, and this could have threatened the ability to stage this historic football event. With the help of WHO mass gathering protocols, which were adopted, which allowed us to proceed with the tournament. The WHO also provided leadership and technical support to the Presidents and the National Department of Health in the successful organization of the Presidential Health Summit. The Presidential Health Compact emanating from the summit is now a guiding blueprint for the attainment of quality health care for all South Africans and forms a solid basis for for the realization of universal health coverage. The Control of Tobacco Products and Electronic Delivery Systems Bill, approved by Cabinet and published for public comment until Thursday, 9th of August 2018, is explicitly supported by the WHO. It is consistent with South Africa's obligations under WHO Framework Convention on Tobacco Control and brings our country back to the forefront in the international tobacco control best practice. Whilst the WHO name was well known and trusted, it was not usually part of everyday civilian conversation. Now the WHO is part of our work language, our dinner conversations, and our social media banter, and a lot of arguments. And so today it feels more like welcoming family members into our family crisis. The coronavirus has indeed forced us to find a meaning to the term global village. Makes us all look like just one small community facing the same challenges together. I pay tribute then to the men and women of this organization and the leadership that has been shown during this unprecedented time. You are all most warmly welcome to our country, and I'm sure that you will find a motivated, tenacious, energetic, and resilient people to inspire the work that you will be doing. I would also like to extend my gratitude to Dr. Mweti and Dr. Mike Ryan for the support and the guidance that the search team will receive from yourselves through the virtual consultations, and I'm particularly grateful that Dr. Mweti is here today with us on the South African soil for a while. And I really must say we are very pleased that you are here personally to be part of this very important intervention. History is peppered with incidences of major disease outbreaks, some of which obliterated nations and cultures, and in other instances changed the course of history forever. The devastation of past pandemics are part of our fabric even in modern times. So many of our experiences, customs, traditions were forged during these times of crisis. One of the earliest records that can be found in Hamin Manga, a 5,000-year-old archaeological site in the northeastern China, where a mass grave was discovered. Scientific evidence suggests that this prehistoric village and nearby villages were obliterated by a plague of unknown origin. Artifacts from archaeological sites show some advancement in the case management and containment measures, with antiseptic lime being discovered covering the bodies of those in those sites, and a clear evidence of organized cremation of bodies. In some instances, these plagues expose the dark side of humanity, sometimes causing permanent extinction of indigenous population. The American plagues of the 16th century that were imported by European explorers led to the collapse of the Inca and Aztec civilizations. Ravaged by the disease, they were unable to withstand the Spanish forces in 1519 and 1532 that subsequently colonized the region. When Philadelphia went through a yellow fever epidemic in 1793, it was assumed that black slaves were immune, and so the abolitionists called for them to be recruited to nurse the sick patients. Before the advent of coronavirus, South Africa was already faced with a triple burden of HIV, TB, and non-communicable diseases. Our people were highly anxious about the stories that they were hearing from China, and there was a great concern about what would happen to millions of South Africans who suffer these ailments. When we consider the socio-economic devastations pandemics can cause, it is without doubt that one of the humanity's greatest achievements was the establishment of the WHO in 1948. It is from this organization that one of the most important definitions of our civilization was forged, and that is the WHO defining health, and I quote, as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, unquote. This definition was a paradigm shift in the way healthcare would be approached in the 20th century and would push us in the direction of realizing the aspirations of universal health coverage. We have seen from history that failure to identify and contain the spread of the virus can literally wipe out entire nations. Indeed, the origins of the WHO began as they inherited projects from the Health Organization of the League of Nations, specific epidemic control and quarantine measures, and drug standardization. This heralded an era of enhanced cooperation between nations to safeguard the health and safety of all our people of the world. History has also shown us that whilst disease can and does touch everyone, it causes most devastation, even elimination amongst the poor, the vulnerable and the oppressed, in particular the oppressed indigenous peoples. Disease can be used to further subjugate and expose vulnerable populations, and it can be used to advance nefarious political and economic agendas. It will expose a nation's weaknesses and drive existing wedges into deep craters between members of society, divisions that can sometimes never be bridged again. As I speak of these phenomena, it is stunning to think that we have already witnessed all of these unfortunate sequelae in the 9 short months. Added to this have been some distinguishing features of the advent of the virus in current times. Advancements in communication and exchange of information has led to unprecedented levels of scrutiny on political leaders, the healthcare sector, academics, scientists, and even civilians. Increased connectivity, ease of travel, and densely populated urban settings have seen an unprecedented spread of the virus. However, I believe that the stewardship of the WHO has ensured that we are able to take lessons from the history and tell a better story of the way in which we have handled the coronavirus globally and locally. What I'm most proud of is that the WHO has remained committed to all the nations despite some critical and even withdrawing sorely needed funding resources. It is unfortunately sad, a sad fact of life, that times like this do sometimes create the best and worst from us. As political volatility escalates around the world, it is also telling that during our time of need, we did not hesitate to call on the WHO to bolster our efforts, and the World Health Organization did not hesitate to respond to that call. On the eve of the WHO announcement of the public health emergency of international concern, I made a commitment to the country that we were adequately prepared for active surveillance, early detection, isolation, and case management, and of contact tracing and prevention. Just want to be sure that there's no need to manage your ICT up there. Are you all fine?
Minister, I think what's happened is Director General has probably had to go.
Oh,
we are
that's
still
fine.
fine, yeah.
We're still fine.
Yes,
Okay.
but this is an opportunity. We've flattened the screen and no one can see you.
No.
Can you lift it again?
Okay.
Okay, I'll
Okay.
unmute her. Okay, Minister. Do you want me to?
Yeah, no, that's
Okay,
fine.
that's-
No, no, no
Is it
problem.
fine? Okay.
Yes, we'll be fine.
Thank you.
Okay. Yeah, the amount of ICT lessons that we've had to take in these past few weeks, I think we should be given some diplomas of topics. And certainly on Zoom meetings, I get lessons every day. I thought I was a master. Until now, somebody told me that I'm no longer visible. So thank you very much for that assistance. I was then saying that at that time I made a commitment to the country that we were adequately prepared for active surveillance, early detection, isolation and case management, contact tracing, and prevention of onward spread of coronavirus infection, and to share full data with the World Health Organization. Since then, we have received continued support on many levels from the WHO, and it has been through robust scientific engagement with this organization that we have been able to make governmental undertakings to manage COVID-19 outbreak. We have received queries why there should have been a need for the surge team if we are past the surge. We have at this point, I'm sure everyone has been aware, that we have now been seeing a decreasing number of cumulative of daily cases as high as to about 12,000 per day. We're now down to around 3,000. And this is a totality of the whole country, when there were parts of the province, or some provinces, that on each would actually raise the numbers by 3,000, 4,000, up to 6,000 per province, in some instances per day. We have then seen in the past few weeks that we are actually getting the country over the surge. I've actually had a very interesting engagement, because not only did we see the numbers of positive cases reducing, we've also seen the number of tests reducing. And so we've started calling each other and asking whether we're missing something, what has happened to the tests. So our starting point was to talk to the laboratory services and ask them if they had enough diagnostic kits to conduct the test. They've assured us that they have. And then we went then to check whether in fact they still had any problems of the backlogs which we had experienced in the past. And again, they've come back to say, no, not anymore. And then, of course, we asked them, what is your turnaround time? Then they've said, our turnaround time has come back to, in some instances, within 12 hours, and in some cases, 24, at the latest, at the longest, is 48 hours. And so, as you look through the epidemiological curves that we are showing the movement of our pandemic, and if you drill deeper into the 7-day running or moving averages of weekly increases, we can see that literally on the major provinces that were carrying the highest burden of the virus, they are on a downward trend, and in some of them there's already a plateau. Now this, for us, is good news. We have said we're very cautious about it. We're very optimistic, but we're very cautious because we don't know why that has happened. We also must say that while the surge was anticipated, the surge has happened in numbers that are much less than originally planned. And the regional director has alluded to the fact that the impact of our lockdown can also be attributed to as the reason why we've got this kind of pattern. But nevertheless, we are saying we remain cautious as we have so many more months to still traverse and be sure that we are over the problem. So if we look at the current models, they have had to be revised several times, but on all those models, what has been said was that we will have the surge at a bit of a lower level than what was initially postulated, but at the same time, it is said that the surge would be July, August, in some provinces, August, September, probably extending to October in some of the others. As we see the pattern now, it looks as though we are over the peak, even though our predictions still have another 2 months of concern about a possible surge. Because we wouldn't be in a position to predict how the pandemic would behave, we therefore believe we have to err on the side of caution. Keep our levels of containment up, keep the levels of vigilance up, keep the levels of strengthening of our system at the best possible level, and continue to motivate our health workers to continue to face the fight and continue to mobilize our communities to make sure that their focus is that we will defeat COVID-19 in the hands of our ordinary citizens on a day-to-day basis, when they wear their masks and they ensure that social distancing, and they ensure that they wash their hands and use hand sanitizers, cough etiquettes, and spread the correct information about the coronavirus. We have therefore received these queries about why would we need the surge team if we are past the peak. And this is the explanation that we can never take anything for granted. We rather err on the side of caution. We are not past anything yet. We will only know when we are many, many months away from the positive cases being reported in the country. We're only now considering some of the potential areas of easing of restrictions, and that is under discussion at the moment. And when that happens, we will expect that there might well be an upsurge. We moved from around 40,000 when we got into level 3. That's when we moved up about 400,000 cases within about a period of about 2.5 months. In 1 month, in June, we actually moved by 100,000 positive cases in 1 month. The following 2 weeks of July, just 2 weeks only, we went about 130,000 cases, positive cases upwards. So we do understand that there is a need for us to ensure that we balance the lives and the livelihoods, and we have to actually help communities to get back to normality. But at the same time, we do know that as we ease the restrictions, so will the rate of transmission increase, and therefore the only thing that will stop the rate of transmission from increasing will be when people have adopted a new culture of distancing and use of masks and prevention to ensure that we can defeat the person-to-person spread of the coronavirus. So whilst we have to focus on that, we have to therefore strengthen our systems. With the real threat of resurgence remaining very real, we would therefore not want to repeat the recent history that has been observed in some of the countries where we allow a second surge, which will wreak havoc and further destruction. As we have seen 2 weeks ago, Dr. Mweti, we had a presentation from the NIH and some of the experts from the United States of America. They gave us a shocking story of how everyone looked at the pandemic coming down, and in all subnational regional records, it was quite promising, and all of a sudden, it never reached zero. And then a few weeks thereafter, it started surging upwards to higher levels than what had been before, and with more devastation than they had already witnessed. I would therefore say, from where we sit, we need to ensure that we strengthen our capacity to contain the infection, to monitor the spread of the infection, to engage our communities, to become an active combat force in the fight against COVID-19, where each and everyone gets out of their house to go and face a new battle of ensuring that that particular day they are not infected, neither would they have infected someone else. And that should be a daily battle for each individual citizen in South Africa. That, for us, is where the battle against COVID-19 will be defeated. The 16 team members who have now arrived in the country, we have been grateful to hear that the total will come to 43. Those that are already here with us have begun their orientation to ensure that there is optimal alignment and of programs. The work of battling the pandemic does not begin and end, and therefore we will be encouraging agility, and we welcome the fact that they will be looking at our situation with fresh eyes and may be able to identify blind spots or offer perspectives we might not have considered. They may be able to reinforce what we are doing, to confirm what we have already found to be true, and in some instances we will be welcoming that they come up and raise issues of any shortfalls or any areas where we might have had missteps so that we can ensure that whatever we have done has got the best possible support from available expertise. There is a broad range of expertise in this team, and largely this includes surveillance and streamlining of epidemiological systems, and then secondly, WHO and global COVID-19 response guidelines also focus on case management, as well as expertise in communication and stakeholder engagement to increase community buy-in. So for us, what will be important is to make sure that at the end of COVID-19, our surveillance and epidemiological analysis are strengthened at a district level, not just for COVID-19, but for TB, for HIV, for diabetes, for hypertension, so that we are better able to manage the disease burden at a district level. These systems must be able to help us to look beyond the COVID-19 crisis. In other words, we see the COVID-19 crisis as an opportunity to also deal with some of the weaknesses and challenges that our health systems are facing. We've already got support from our cabinet, led by our president, that we should focus on strengthening issues of infrastructure, issues of human resource development, issues of quality of care, and all of these are what we need for a future health system. And the strength of our response will be as good as the legacy that it will leave behind as we move towards a much more equitable health system where we're focusing on universal health coverage, and in our case, on the lines of national health insurance. So South Africa and many other nations have therefore shown that it is possible through multi-sectoral collaboration to slow down the rate of infection and rebuild livelihoods after initial devastation. Our biggest challenge is the rebuilding of our economy to eliminate unemployment, poverty, food insecurity, hunger, starvation, and ensure that we've got a much better community afterwards. So the basis of our renewed economic renewal is actually a healthier population, which is what the National Health Insurance is also supposed to achieve. So with this team buttressing our efforts, we should further look for opportunities to emancipate the impoverished, the oppressed, and the vulnerable using innovations that have emanated from this crisis. If history will be altered, it should not be because some won and some lost because of the pandemic. It should be that we all held each other's hands and pulled each other through the storm. That is what we said that will set us apart from our forebears. And this is a crisis that's calling for Ubuntu, where we say, you are because I am, umuntu, ngumuntu, ngabantu. Human is human because of other humans. And what you have done, coming to our rescue, coming to support us, coming to strengthen us, you have shown true meaning of Ubuntu by saying to yourselves, you will be there where we need support. You will be here as a symbol of global solidarity. You will be here as a symbol of the spirit of voluntarism and assisting and supporting others. And we trust as well that there will be many lessons for you out of this pandemic. Seeing that South Africa is at the epicenter in the continent, we believe that lessons from South Africa should also be useful to help the rest of the continent that may not have been exposed to the same extent than what South Africa has. Let's take the opportunity to learn lessons, to spread those lessons to other parts of the continent. You will find in South Africa a huge team of professionals, various experts, highly experienced, competent, and are busy at work dealing with this issue. And we would like you to join them as part of the team. You will teach them a lot, they will teach you a lot, and all of us together, we will learn to create the best possible response that our continent will need to be able to face this and other future pandemics. And therefore, we want to thank you for joining us, and there will be various sessions where we will ensure that you meet with some of the experts in the country to share ideas and explore various solutions. I do anticipate that out of these engagements, there will be solutions that may even be helpful for the whole global response. We must take our engagement as an opportunity to learn and to make a contribution to solutions we need to contain this and other future pandemics. So with that, I want to then welcome you, and I want to say again to my lovely sister, Dr. Matshidiso Moeti, thank you very much, and to my brother, Dr. Tedros, thank you for all the support all the time. As of Dr. Kalua, he's at home here, and so every time we would get the assistance, and your presence is reinforcing several groups of technical experts that we have brought in before you, and as under the auspices of WHO. So we really look forward to a lot of working together and a lot of experience that will be shared amongst us. And of course, at the end of it, we're looking forward to a South Africa that will have defeated COVID-19. We look forward to South Africa that would have limited the devastation, both in terms of human lives lost, as well as in terms of economic destruction that this virus poses as a threat. But that at the end, we should turn around and say, we did it, we were united, we did it together, and we did ensure that we take South Africa to turn for the better, and that because of all of the work that has been done, all health workers and experts united, and all frontline workers, we have been able to save humanity, both in physical terms as well as in terms of solutions that will be exported to other parts of the world. And therefore, we want to welcome you and thank you very, very much for coming to join us and reinforcing us. Thank you very much.
Thank you very much, Kabazela, for a crisp message. I would like to also acknowledge the Office of the President is actually online, the advisor to the President, Professor Olive Shisana, and other colleagues. At this moment in time, I would like to invite again the Regional Director, Dr. Matshidiso Moeti, so that we can put the faces to the names, or the names to the faces, to introduce the team. Over to you, RD. Thank you.
Thank you very much, Program Director. So it's my great pleasure to, in my turn, welcome our team here and to introduce them one by one. So some are here, some are connected, I believe. I'll start with Professor David Heyman, who I already mentioned in my statement, who is going to be supporting the coordination, the policy making, and some of the technical matters. David, here you are. So Professor David Heyman is nodding his head at the bottom of the screen over there. Next, Dr. Ambrose Talisuna, who is an epidemiologist, public health specialist from the regional office, who will also be supporting the incident management coordination from the WHO office. Ambrose. Dr. Laston Gona, who will be supporting risk communication and community engagement. He's over there at the back. Dr. Farai Mavunga, who will also be supporting incident management and coordination. Dr. Megan Sumat, who will be supporting infection prevention and control. Okay. Dr. Constant Dedo will be supporting epidemiology, surveillance. Is he on screen or is he in the room? Ah, okay. Great, wonderful. Welcome. Dr. Virginia Wambui Gitau will be supporting case management. There she is. Great. Dr. Valerie Kazadi, infection prevention and control specialist. Dr. Tesi Mutembe Karimba will be working on epidemiology, an epidemiologist. There you are, great. Dr. Goitam Kebrimedin Welde Gabriel, epidemiologist. Okay, great. Dr. Otim Patrick Kosi Ramadan, epidemiologist. Okay. Dr. Charles Kipkoech Korir, epidemiologist. Oh, he's down there. I can see your hand, all right. Okay, wonderful. Dr. Winfred Opong Omako, Risk Communication and Community Engagement. Thank you, welcome. Dr. Mutale Mumba, epidemiologist. Is he here? Dr. John Masina, case management. Okay, great. And Ms. Nene Mariama Ba, logistics and procurement. So she and I traveled together. I think she's in self-isolation somewhere. There you are, Mariama. So dear colleagues, I in turn would like to thank you for having volunteered, agreed to join our team here, and wish you a very fruitful, enjoyable, rich mission. I'm sure that we'll be learning as much as we'll be contributing to what the South African government and people will be doing. Thank you very much, Chair.
Thank you very much, Dr. Moeti. It's now my honor to invite our Deputy Minister, Dr. Patla, to come and deliver the vote of thanks on behalf of the department. Thank
you very much, Program Director, DG Bitelezi, for steering this program. Our Minister of Health, Dr. Mkhize, DG for WHO, Dr. Tedros, and our apology for the struggle with the technology, but ultimately it all came right. We were able to get the message. The Regional Director for WHO Afro, Dr. Moeti, we indeed very grateful that you made the trip to be physically here, and maybe we should also say welcome home to your second home or third home from Botswana, also South Africa, and also Brazzaville as the other home. To our country representative, Dr. Kalua, as already mentioned, indeed we consider him to be a South African. I think he only lacks citizenship, otherwise he's a South African. Our managers, our management from the Department of Health and all other colleagues, and indeed the most important people for our gathering here is the WHO team, which has been introduced here by the RD. Indeed, if it was not for your willingness to come and help, to respond to our President's call for send me, which is said in our language here, Tumamena, we would not be here. So indeed, we are grateful that you are willing to be tumat. And that's why we are here today. We want to thank our Minister for taking the initiative to engage with the Director General, Dr. Tedros, to request assistance in this fight against the invisible enemy. And indeed, very grateful that Dr. Tedros and the RD and their team responded very speedily. I must say, when we had the virtual meeting the other time, a couple of weeks ago, I didn't expect such a speedy response. I thought the bigger the organization, the slower the movement. and being such a big organization, I thought, but you have proven me wrong, that you were able to move with so much speed. Indeed, we thank you for your leadership at the world and also at the continental level for leading this fight against this invisible enemy, and indeed for your very prompt response. We appreciate this assistance. We, as already been emphasized by all the speakers, we are indeed all learning how to manage this invisible enemy. But we are cognizant of the fact that at the world body and also with the regional office in Brazzaville, you are in a vantage position, better placed than us. We also, learning all the time, but we believe that yourself, the world, sitting there in Geneva and Brazzaville and all over the world, you are at the vantage point to get a fair assessment of various experiences with the reports which you get from your country offices, regional offices. You are better placed to can synthesize all the information, lessons, experiences, as you regularly also update the world, that by sending this team here, we will be in a better position to can, benefit from that experience and be able to plan better. So we're looking forward to the guidance, as we have been saying in some of our meetings here with President Ramaphosa, saying that as we deal with this pandemic, we are in a situation where it's like crossing the Zambezi or crossing the Limpopo, and you cross by feeling the stones. But in this case, we will not have to feel all the stones, because the team here, which has got an advantage of accumulating various knowledge and information and experience, will be able to tell us that don't go this way, because there's going to be very sharp stones if you proceed in this direction, because indeed there are a lot of unknowns at this stage, but we are quite confident that with the kind of expertise you have added to our fight, we will be able to cross this river at a faster pace and with a lot more lives being saved. Indeed, COVID-19 has brought a lot of new ways of doing things, as we are doing even here today. And this just reminds me of the fact that I'm not sure if you look into the history of the WHO, there should be very few situations where the World Health Assembly hasn't sat. And the fact that in May this year we had to go through a virtual World Health Assembly, and in a few days, 10 days, just over 10 days from now, we also will be going through a virtual WHO Afro summit. So this is just a reminder that also as the health as the nations of the world in the health sphere, we are also highly affected. But we believe that this indeed will pass. So just adding to Minister Mkhize to say, indeed, we want to say to you, the team, indeed, you are very much welcome. We're looking forward to interacting with yourselves, with the leadership of our DG here and the rest of the national team and the various structures which have been set up across the country. We are indeed very confident that as South Africans, we are going to benefit from your presence. So indeed, in my language, which Dr. Mweti will understand very well, we say, "Realamugela, realamugela, siyanamugela ngesizulu, kaSotho realamugela, so liamugetse bagaetsho. Welcome to Mzansi, Africa. Thank you."
Thank you very much, Tony Shwatau. Once more, thank you to Dr. Owen Kalua, who is able to pick up my calls at 10 o'clock at night, very late, to try and pull this together. The team that prepared, Sislebu, who's head of our International Health Liaison, Dr. Neluheni, Dr. Anban, Dr. Patrick, and all of them. And we will be working with the team quite closely. And thank you again to the members of the media for joining us, our other colleagues, the Office of the President, and of course, under the leadership of Dr. Mkhize, we are led in the department. We now adjourn our meeting. Thank you very much.